This is what your face looks like after 2 weeks of quarantine. I'm Rugans, and today we're going to talk about the Dominican Republic and the coronavirus. On the 1st of March 2020, the first case in the Dominican Republic and the Caribbean was confirmed. A 60-year-old man from Italy entered the country on February 22nd and fell ill on February 24th, when he was transferred to the hospital from the beach resort of Bajayibe. On March 6th, the second case in the country was confirmed as a Canadian tourist, also vacationing in Bajayibe, was detected. On March 8th, 3 more cases were confirmed from Dominican tourists that came from a trip to Italy. And on March 14th, the Minister of Public Health confirmed 6 new cases. All of the individuals had been outside of the country within the past 14 days. The first documented case of local transmission seems to have originated from a 56-year-old Dominican woman from the town of Villarriba on Duarte province, who had traveled from Italy to the Dominican Republic on February 26. The woman refused to be sent to Santo Domingo to be in isolation after receiving her COVID-19 positive diagnosis, returning instead to her home. She seems to have passed on the virus to her neighbors. 2 weeks later, Duarte province confirmed number of cases are only surpassed by the 2 larger urban centers, the National District, Santo Domingo, and Santiago, in the number of cases and leads in the number of casualties. This cluster of cases seems to have originated around those in close contact with the woman. On the 14th of March, a high-profile wedding in Cape Cana, Punta Cana, seemed to be the COVID-19 infection source for a number of its attendees, which included many foreign residents. The wedding received a lot of public criticism for having had a crazy hour theme mocking the coronavirus concerns. The Chancellor of the Dominican Republic, Miguel Vargas Maldonado, would have contracted the virus from his son, who attended the said wedding and also contracted COVID-19. The first COVID-19 related death was announced by health authorities on the 16th of March 2020 of a 47-year-old Dominican woman who had recently traveled from Spain. On March 24th, renowned designer Jenny Polanco, who tested positive on March 15th, died too. And on March 27th, Armed Forces Colonel Khalil Ache passed away, and his widow will also die the next day. On March 17th, the president of the country gave an address to the nation and declared a state of emergency, announcing a series of measures to try and stop the spread of the virus. He ordered all land, sea, and air borders to be closed for the next 15 days, taking effect as of March 19th, which caused the influx of passengers headed abroad to jump at the airports, especially the Punta Cana and the Las Americas international airports. Hundreds of passengers formed lines at the counter of the airport's departure level, checking documents and other doing errands to board flights to the United States and other nations. Up until 2 days ago, a group of Argentinians were still stranded at the Punta Cana International Airport. As of April 2nd, 2020, the Dominican Republic has 1,380 confirmed cases of COVID-19 and 60 confirmed deaths. In 48 hours, 271 new positive cases and 50 new deaths were reported. Of the infected patients, 147 are isolated in hospitals, while 1,071 remain in home isolation. The Dominican Republic Association of Hotels and Tourism said its members have made available to the government over 1,500 hotel rooms to the Public Health Ministry, and also that 13 hotels continue to operate in several parts of the country, offering services to tourists who are still here due to flight restrictions imposed by many countries due to COVID-19. Those establishments will be operating until the guests can return to their respective countries. Don't forget to subscribe to the channel for more news of Punta Cana and the Dominican Republic, and see you tomorrow for live coverage of the streets of Punta Cana amid the coronavirus.